Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Kasavayadi, and in that regards, I have discussed with you about Pitta Jakas. Why in clinical practice, when a patient of Kas comes to you, we always ask only one question: whether it is dry, that is called as Vata Jakas, or it is wet, Kapha Jakas, and we hardly ask about the Pittaja Lakshana, Dhumayan, Daha, etc. And reason behind that, logical reason behind that, which I have put forward in front of you, that there is no Pitta Dosha Sthan in the Pranava Srotas, and hence Vata and Kapha Jakas are commonly seen because they both have Urasthan as their sthana in by nature. And for Pitta dosh, he has to get transferred to their these pranasadas first, then get accumulated Sanchay, Prakop, Prasar, and all these things are not so easy for Pitta dosh, and hence in practice Pitta Jakas is very rarely seen. To support this my statement, I will give you some more examples so it will give strength to this my statement. Now, when Charak Samhita has described Chikitsa of Pranava Srotas, the common Chikitsa told by Charak is Pranava Srotas or Pranavakanna Vahini Srotasam Dushtanam Shwasiki Kriya. That means Chikitsa of Shwasa Vyadi will be the Chikitsa of Pranava Srotas diseases. It is given as a general rule. And what is the Chikitsa of Shwas Vyadi told by Charak Samhita? Yat Kinchit, remember, Yat Kinchit Kaphavatagnam Ushnam Vatanulomanam. Yat Kinchit, anything, Yat Kinchit, it may be a small or big, anything which is Kaphavatagnam, which is Kapha Shamak or Vata Shamak, Ushnam, Vatanulomanam. It should contain Ushnavirya and should have property of to make the Vayu Anuloman. Such Aushad or Ahar is good or to be given in the Shwas Vyadi. Beshajam cha annam cha vihitam shwasakinam. So, in this Chikitsa Sutra of Shwaswadi, they have told Yat Kinchit, anything which is Kaphavatagna. And Charak Samhita has not mentioned Pitta Dosh in this Chikitsa Sutra of Shwasavadi, which he describes that Chikitsa of Shwasavadi Vyadi is the Chikitsa of Pranava Srotas diseases. Yat Kinchit Kaphavatagnam Ushnam Vatanulomanam, there is no reference of Pitta Dosh in this Samanya Chikitsa Sutra of Shvasa Vyadi, and this is the second reference I will put in front of you. That's why in practice we come across Vataja and Kapha Jagas mainly, and hardly Pitta Jagas is seen. If it was seen, then Charak Samhita must have described something about Pitta Dosh or Pitta Jagas type, but they have not mentioned Pitta Jagas at all. So, this is the second reason or second logical statement which will denote that Pitta Jakas, though mentioned in the text, is rare to see in our clinical practice. So, Vata Kapha Jakas commonly seen Vyadi Pranava Srotas, and Samanya Chikitsa of Pranava Srotas is Shwas Chikitsa, and Shwas Chikitsa comes under Yat Kinchit Kaphavatagnam. Always remember, whenever they have mentioned the specific words like Yat Kinchit or Cha or Eva, Api, Va, all these words when you read in the slok, always remember that they have to tell some specific meaning by describing or writing these words. You will not find these words in every shloka or commonly seen. So always remember, when these such words come in our Chikitsa Sutta or any in the Grantha, you have to keep in mind that they have to describe some special meaning and to us through these words. So in this Shwasa Chikitsa, Yat Kinchit means anything. Anything which is Kaphavatagna is good in the Shwasa Vyadhi and so in the Pranavasota diseases. Hence, if you go through the Pranavasota diseases, like Pinasa, Pratishay, Kasa, Shwasa, in all types of these diseases, you rarely come across the Pittaja type. We rarely think of Pitta dosh, and even patient also rarely describe the symptoms of Pitta dosh. And these are the reasons behind that. Sometimes in clinical practice, you will find the cause because of the inflamed pharyngitis, and many a times the reason is not the pranasotas, but it is because of the acid formation in the stomach. That cast lakshan, though there is a cast, the pharynx is red, you have to think of acidity or pitta vritti in the amashay. In modern science, it is called a reflux. So, acid reflux. So, in that case, that disease or that lakshan, you have to think of Anna Srotas than Pranavaha Srotas. So, whenever there is a Pranavaha disease, Vata and Kapha are more important as compared to the Pitta dosh, and the reasons I have discussed with you. Hope you understand, and I will like your suggestions and comments in this matter. Now, the two castes, Shataja caste and Kshayaja caste. In Shataja caste, there is a wound in the lungs, and there is bleeding, and there is Raktakshay and Raktasthivan. Here, the caste lakshan is there, but main chikitsa is to heal the vrana of the lungs and to stop the bleeding. Kshayaja caste we will describe in the next future when we will discuss Rajayashma, my opinion of Rajayashma at that time. So, hope you understand Vataja Kasa Vyadhi, their clinical applications, variations in the patients we see in the clinical practice, and hope you have liked all these discussions. We will talk about the next topic in the next week. I request again to subscribe the channel, forward to your friends, give suggestions and your opinions on my lectures. They are all welcome. Thank you very much.